Mr. Chairman, ladies and gentlemen, we're going to talk about health screening. My question to you all is, who believes in health screening? You get the majority of people. Does anyone have reservations about health screening? Who doesn't know anything about health screening? Health screening is a process of investigating, evaluating people to see if they have the early stages of any disease or condition. And the most important aspect of health screening is at the time of testing, the person doesn't have any symptoms. So it's a test cold, if you like. Now traditionally, medicine is about investigating people who already have symptoms. So if you go to your doctor and you've got a pain or something, the doctor will carry out tests, do investigations, come to a diagnosis and give you some treatment. But over the last few years, there's been an increasing emphasis on preventative medicine. And current guidelines, national guidelines on healthcare, are looking far more at what's called preventative medicine, which involves health screening, but also health education. I'm sure you're aware of all the publicity around not smoking and doing more exercise and being good boys and girls. All this is based on the premise that early intervention is a good thing. That sounds logical, doesn't it? If you find some of the early stages of any problem and you carry out some tests and find out that that's the stage they're at, and you give them some treatment, then the condition will be cured and the disease, whatever, will go away. That's the premise. So, is there a downside to this? Well, I think there probably is. Because sadly, nothing in life is perfect. Let's look at the problems. And the first one is accuracy of the testing process. If you investigate somebody, find they've got positive signs of some health problem, and you tell them, that's a good thing. That's called a true positive. This is what's called sensitivity of the test. On the other hand, if they go positive and they haven't actually got a problem, it's a false result. It's called a false positive. The fifth side of the process is looking at specificity. This is looking at negatives. If someone's tested, who's got no evidence of any problem, you give them the all clear. That's fine. If, on the other hand, you say they're negative and they really have the condition, that's called a false negative. Let's look at some testing. There was a paper published 10 years ago in America. What they looked at was the retrospective analysis of mammograms testing for breast cancer. They looked at some testing carried out a few years previously, and the testing was 339 cases of women who had mammograms. Now, 6 of these had tested true positive. Fine. 180 had tested true negative. They didn't have a problem. That's 186 out of 339. What about the rest? 60 people tested as false positive. So they were told they had the condition and they didn't. 93 were tested as false negative. So it wasn't picked up at the time, but subsequently they were found to have breast cancer. That's quite a lot, isn't it? second aspect of problems with screening tests is a psychological effect of screening. Let's consider these people who were tested for mammograms. What about the false positives? They were told they had the condition, and they undoubtedly had some treatment. They might even have had mastectomies, they might have had radiation, they might have had chemotherapy. And there was actually no problem there at all. What about the other? What about the false negatives? They were told they didn't have a problem, they were given the all clear. And they went away quite happy. Subsequently, these people were found to have breast cancer. And by the time they were discovered, the condition had developed to a stage where it's more difficult, if not impossible, to treat. So the testing process wasn't that good. There are also what's called quiet cancers. The main lots of people are tested for cancers, found to have a positive result, and this cancer was what's called a quiet cancer. It's not going to progress to any life-threatening condition. This is clearly the case in prostate cancer screening. This country now doesn't advise prostate cancer screening because there are so many cases where people are tested positive and then go on to live a full life. In fact, it's said that more people die with prostate cancer than of it. So the testing process is not very good at picking up cancer that will develop into life-threatening conditions. So health screening can be a good thing, but there can be drawbacks. The message that I'm giving you tonight is before you embark on health screening, be sure you find out whether or not it's really going to benefit you. And my message is the quality of life is often more important than the quantity of life. Thank you.